This forum, Health for One and Wana, moving forward with the Philippine Health Agenda, comes at an opportune time as we approach the first year of the Duterte administration, an administration that has promised change in the way government serves its people, especially the poor and the vulnerable. When I assumed office, the President gave me 3 marching orders: wage a war against illegal drugs, against corruption, and against poverty and ill health. Today, we have indeed gone a long way in carrying out our mandate. It is my privilege to present today the administration's milestone for health, a year of the Philippine Health Agenda. On September 15, 2016, we launched the Philippine Health Agenda 2016 to 2022 during the National Health Summit. Our battle cry is all for health towards health for all. Our way of emphasizing that health is everyone's concern and business, and we cannot leave anyone behind. Gone are the days when important health matters are discussed only within the confines of the Department of Health. I am very happy to see today's forum demonstrate this whole of government, whole of society approach towards health. As the different national government agencies, including the Department of Finance, National Economic Development Authority, NEDA, Department of Budget and Management, Department of Trade and Industry, Department of Social Welfare and Development, and Department of Interior and Local Government are represented in various capacities. The presence today of my predecessors and mentors reassures us in the Department of Health's long-term commitment to take the lead and collaborate all efforts to serve Filipino patients and their families. The focus of this year's forum, Bringing Health to One and Wana, Universal Health Care in the Communities, is also quite timely. Within a devolved system, the Department of Health recognizes that advancing primary care necessitates the local government units fulfill their mandate to provide quality health services to their constituents. It is promising to know that various LGUs are participating today to share their success stories and learn collectively from one another. The presence of partners from the private sector, academe, and civil society organizations is also reassuring, as it affirms that many are committed to ensure that health for all, health for everyone and Wana, is made a reality. Under the Philippine Health Agenda, our goals are to ensure that all Filipinos, especially the poor, are number 1, protected from the high cost of healthcare. Number 2, all Filipinos attain the best possible health outcomes with no disparity. And number 3, that all Filipinos feel respected, valued, and empowered in all their interactions with the health system. We aspire for a health system that is equitable and inclusive to all, efficient, transparent, and accountable, and that which provides high-quality services. The Philippine Health Agenda has 3 guarantees. 1, provide the health services throughout the life stages and protect Filipinos from the triple burden of diseases, including communicable, non-communicable diseases, as well as diseases of rapid urbanization and industrialization. Number 2, a functional service delivery network of all health facilities. And number 3, universal health insurance to grant Filipinos financial freedom when accessing health services. To achieve these goals and guarantees, we have devised the ACHIEVE Achieve strategy, which stands for A. Advance health promotion, primary care, and quality. C. Cover all Filipinos against financial risk. H. Harness the power of strategic human resources for health. I. Invest in e-health and data for decision-making. E. Enforce standards, accountability, and transparency. This is our good governance pillar. V. Value patients and respect clients. And finally, E. Elicit multi-stakeholder support for health. That is why we are all here. The value of advancing health promotion and primary care cannot be overemphasized. This starts from something as fundamental as improving people's health-seeking behaviors and empowering them so that they can take charge of their own health. We want people to stay healthy first and foremost. We want people to change their lifestyles. On our part, we have to provide an enabling environment that will allow our people to do that easily. This also prompts us to go back to the basics of public health: clean water, hygiene practices, sanitation, and addressing other social determinants of health. We are working closely with Congress on a health promotion bill to make sure healthy lifestyles happen. When it comes to a good primary care system, we have much to learn from our local government partners. Existing LGU models show how political will and leadership can make all the difference in creating equitable and responsive local health systems. Health can be prioritized in the allocation of the IRA. If a local chief executive is resourceful enough, partners can be mobilized to generate additional resources to improve health infrastructure and facilities. Support for poor and marginalized can also be institutionalized by maximizing PhilHealth and providing additional subsidies for medical assistance. Some local government units have also adopted a healthy cities approach, placing health in the agenda of all offices in the LGU. I am sure that our mayors and governors can tell you more about their success stories later throughout this program. I am happy to share the following achievements thus far of the Philippine Health Agenda. With the passage of the Sin Tax Law, resources for health have increased significantly from 86.97 billion in 2015. The health budget grew to 122.6 billion in 2016 and to 155.4 billion in 2017. 92% of the population, or 93.45 million principal members and dependents, are now covered by PhilHealth, the National Health Insurance Program. As of 2015, benefit payments have increased to 97 billion from less than 24 billion in 2010. Support value has increased to 56%, meaning more than half of a member's health expenditure is now covered by PhilHealth. In terms of health outcomes, we have been on track with our goal to lower infant mortality rates and under 5 mortality rates at 21 per 1,000 live births and 27 per 1,000 live births, respectively. More than 80% of children are fully immunized, with 73% measles vaccination coverage. 55% of infants are now exclusively breastfed until 6 months. In 2015, Regions 1 and CAR were able to attain the target of less than 52 maternal deaths per 100,000 live births. We have been successful at treating tuberculosis with a 92% TB success rate. We have declared 32 areas as malaria-free and 34 areas as filariasis-free. More than 400,000 patients are listed in our diabetes and hypertension club registries, and treatment packs continue to be distributed to these listed patients. We are also proud to report that we have gains in curbing tobacco smoking. As of 2015, according to the Global Adult Tobacco Survey, the prevalence of non-smokers have increased to 63.7% from 54.3% in 2008, while the prevalence of those presently smoking has declined from 31% in 2008 to 23.3% by 2015. Daily cigarette consumption has also declined. The DOH continues to support the upgrading of health facilities across the country, especially in geographically isolated and disadvantaged areas, or GIDAs. For instance, the people of Sharif Agwak in Maguindanao now has access to the first CT scan in Maguindanao province. Since 2010, we have enhanced 2,862 barangay health stations, 2,626 rural health units and urban centers, and 685 LGU hospitals, and all the 70 DOH hospitals. We have distributed 348 mobile dental clinics that are also being deployed nationwide. We have constructed close to 3,200 school-based barangay health stations. From 2010 to 2015, the DOH has deployed not less than 92,000 health workers across the country. In 2016 alone, we deployed 373 doctors, 291 dentists, 1,513 public health associates, 16,200 nurses, 386 medical technologists, and 4,111 midwives. A number of health promotion campaigns have been launched to fight highly prevalent diseases such as those for tuberculosis, malaria, schistosomiasis, and filariasis. And also, we have done the school-based deworming program twice a year for 2016. In closing, many challenges lie ahead of us, but it is through discussions like this that I gain confidence in our collective strength. For one, we have journeyed the path to universal health care, and we are but a few steps closer to attaining it. Under the Duterte administration, we are moving to institutionalize universal health care and adopting the Cuban model of a health system. As we are moving forward for a more holistic, sustainable approach to make health a reality for all Filipinos. I sincerely would like to thank our lawmakers, particularly Senate Pro Tempore Ralph Recto, I would like to commend and thank the Pharmaceutical and Healthcare Association of the Philippines, PHAP, Asian Development Bank, Swilig Family Foundation, Asian Institute of Management, US-ASEAN Business Council, Quintiles IMS, Medicines Transparency Alliance, META, Health PRX, Havas Life, and other partners, including the World Health Organization, for your efforts to bring all of us together in this meaningful dialogue, a dialogue that will translate to impactful actions necessary to achieve mid- and long-term development of our country.